of enthusiasm, energy, and we were close to win. A lot of excitement. And suddenly, I saw my brother coming from the corner. And he was waving towards me to come. I approached my brother and he told me, Stanzin, mom is not well. She's in the hospital. Then both of us went to the warden, housemaster, we seek our permission and he granted permission to see my mom. And the hospital was very close to my school. When I would reach there, my mother was having some breathing problem. And the doctor advised us to take her to either AIMS or PGIMER. But we were not rich enough to transport her to AIMS or PGIMER. After a few days, she passed away. Now, if today, if I try to understand the causes behind her death, A, why she died? Because we could not transport her to AIMS or PGIMER. Why we could not transport? We were poor. Why we were poor? Because she was not educated. Yeah. And why she was not educated? Because the education facility was not there at that point of time. Why the education facility was not at that point of time? Because we were not having a very strong voice in the mainstream Indian politics. So a lot of problems. Now, if we want to ensure health for all at all ages, then we need to understand, we need to work, we need to advocate health beyond the buildings of hospitals, health beyond the walls of the clinics. Then and only then we can ensure health for all. After my mother's death, I realized our healthcare system are not in fact the healthcare system, they are sick care system. They are not healthcare system, they are sick care system. And the only way we can ensure health for all is if we transform this sick care system into a high-value healthcare system, and which can ensure the health for all. Because there are 5 defining factors for health: your gene, your behavior, your social environment, your physical environment, and the medical services. Interestingly, the medical services plays only 10%. The remaining 40% are either your gene, or your behavior, or your social environment, or your physical environment. And the social and physical environment are the social determinants of health. Had the social determinants in my village, at my home, in Ladakh, been strong, been in place, been inclusive, been accessible, been affordable, I would not have been an orphan at that age when I was 7th class. So this is the time we need to look at the health from a more holistic perspective. But you can see today health is a big business. The way we have designed the health model is the business model. Yeah. And in this era, even if you look at the distribution of resources and power, the gap between haves and have-nots are increasing significantly. So if the people are not having resources, if the people are not having power, how are we going to ensure health for all? We are in the business of constructing new hospitals, super specialist hospitals, in a place like you have rightly mentioned, and one of the most vulnerable caste or tribe is scheduled tribe. They are deprived of access to healthcare system. In city like Chandigarh, Chandigarh is a heaven for hospitals. Yeah? In a radius of 10 kilometers, we have, I think, 15, 20 super specialist hospitals. In Leh, over 50,000 square kilometers, we don't have a single super specialist hospital. Over 50,000 square kilometers. 10 kilometer radius. In a radius of 10 kilometers, we have more than 15 to 20 super specialist hospitals. And this population are depending upon the government hospital, the primary healthcare system, and the district hospital. How injustice it is. And especially Ladakhis get sick, do die, especially in the winter, when the temperature goes minus. And during that time, many people, even the doctors recommend them to take your patient, your father, your mother, your wife or children, take them to places like Delhi and Chandigarh, but they can't. You won't be surprised, the airfare in the winter to Ladakh, it goes up to 35,000 one way. 35,000 one way. So we have designed a system in such a way so that certain section of the people, they cannot access to even healthcare. So unless we strengthen the social determinants, because health never begins at the hospital, but many times it ends at the hospital. I hope you agree. Yeah? Health begins in mother's home. In the places where we live, places where we cook our food, places where we sleep, places even where we shit. Health begins there. So unless we make those places enabling, livable, healthy, safe, secure, then health for all is a distant dream. And this can only be possible that when we perceive that health is not a sole responsibility of the health practitioners or the hospitals or the monopoly of the Ministry of Health Affairs and Health or the hospitals. Rather, we take a collective responsibility from every corners. So one of the principal institutions which can play a significant role in translating the vision or the dream of health for all into a reality is our education system. But unfortunately, our education system is so busy in touching our head. The system is very clever, very sharp in feeding new facts, new figures, new theories, new hypotheses. But in the process, the system failed to touch, many times failed to touch the hands, and many times failed to touch the heart. Obviously, the health also. And that's why many of us are using our body as a transport, yeah? To carry our head from one place to another place. Okay, now I'm working in the hospital to treat patients. Okay, let me, my body carry me, like a Ola carry. Now you fix your GPS, the body will carry you there. Yeah. So our education system has failed to touch the health aspect. We are simply producing a sharp mind, shrewd mind, clever mind, and in the process we have failed to touch the heart. In the process, we have failed to touch the health. So we need to look at the system in a more holistic way. If we want to ensure that health for all, that can be only possible once we work collectively, sir. And so that millions of other children who won't be orphaned like me at an early age, and millions of mothers who would love to see their kids growing, yeah, they can enjoy their life. And that can only be possible once we work together, not during this 2 days work symposium, but how collectively, jointly, with hands in hands, we have the courage and commitment and convictions to work through the journey to translate the vision of the health for all into a reality. Thank you so much.
Dr. Stanzin Dawa has actually touched upon, I would say, when you touch the chord, you feel the pulse. So I guess he's touched the pulse of how we can ensure health for all. Health for all aspiration has to be a human element first, before it comes as a technological intervention or a medical intervention. Very interesting points raised throughout, and one of the most important ones is, what I remember always is that health begins in the mother's womb. How the child that is born, is born healthy and continues to survive through its childhood, through its infanthood. And I'll slightly divert and say, I was surprised to learn that 2.5 crore children are born in this country every year. Close to 2.5 crore children. And close to about 9 lakh. Well, let's say if estimates are taken, about 1 million children die in the first 28 years of life. So, health has to begin in the mother's womb. And it's important that the mother herself is healthy enough to nurture a healthy baby. So it's a cycle that we have to start somewhere else and not in the health facility. We have to decide that. Thank you, Dr. Dawa, for mentioning that. We have the final speaker today.